Welcome, everyone. We are so glad that you could join us for today. This is our fifth online learning opportunity. Today's event is called The Business of Childcare, Vermont and National Perspectives on Where We Are and Where We're Going. I'm Emily Blistein. I'm the Director of Business Strategy for Let's Grow Kids. For today's webinar, we're really excited to be joined by both state and national leaders to discuss the state of childcare and what we might expect in the future. We'll have about 30 minutes for our panelists to discuss their perspectives with you, and then about 25 minutes for your questions. Today, we're joined by Aly Richards, CEO of Let's Grow Kids, Lynette Fraga, Executive Director of Childcare Aware of America, Morgan Crossman, Executive Director of Building Bright Futures, and Lawrence Miller of Five Vine Consulting. As usual, each of us are recording from home with our animals and children and internet service on a rainy day. So we're going to do our best to give the best presentation to you. You are muted. We can't see or hear you, so we don't have to worry about that from your end. Just a few reminders before we get started. We would love for you to use the Q&A. It's super tempting to use that chat. The Q&A is just to the left of the chat, and that really allows us to catalog your questions and ask them in the way that they actually get answered. It also allows us to save your questions. There's a lot of you on today, and when there's a lot of you on, we tend to have a ton of questions. And so if we're not able to get to your questions by asking them in the Q&A, we can follow up with you after this recording. This webinar, like the former ones, will be recorded. Though that's available to you on our website. And also, as was the case last week, today's webinar has been approved for Northern Lights. To have this hour count, you need to register with your BFIS number, and you do have to remain on for the entire hour. If you have any questions, Ansley's email is there. You can contact her. And as I just mentioned, we also would encourage you to go to Let's Grow Kids' coronavirus website. That's where we have everything that you could need in terms of getting information from the past webinars. We also have been compiling FAQs. There's a lot of really good information there, so they tend to be pretty packed with information. If you want to re-look at some of the stuff we've talked about, that's where you should go. Today's webinar really is taking an expansive look at the industry, and I'm really excited to dive into that. We got a chance to talk to Aly and Lynette and Morgan and Lawrence a couple days ago, but we have been talking about some of the more nitty-gritty issues of running your business, issues of taxes and HR and legal concerns. So if some of those questions are remaining for you, we want to remind you that we've set up a new free service for you. And as you can see on this webpage, it's a drop down from our resources for early childhood educators. And so you just drop down and you can put your questions in there, and we'll be able to match you with somebody for an hour of free consultation. So we'd encourage you to use that. We are going to be taking next week off, but plan to continue these webinars. So if there are issues that you have questions about, please do drop them into the online form that we have, where you can help us understand what your biggest concerns are, or get in touch with anyone from our programs team. Thank you again for joining us. I'm going to hand it over now to Aly.
Thank you so much, Emily. It's such a pleasure to be here with you all. I've been hearing so much about these weekly webinars from both panelists and participants, and it's just a true highlight of this wacky pandemic period that we're in to spend this time with you today. So the first real message that I have is thank you. I mean, from where I sit in this last, almost 2 months, it has been an honor to watch the childcare sector. An absolute honor. And, as you know, we're here for you at Let's Grow Kids. We'll continue to provide resources like this webinar. We have our resource page. Our programs team, is there for you anytime as you pick up the phone or email. We're handling up your thoughts and concerns to policymakers and decision makers always. But so many other people are there with you too. And I just want to take a minute to explain that. It has been amazing to watch Vermonters at work through this. with a good old fashioned grit and common sense like I haven't seen really anywhere else. And one example of that is how many folks, for example, you guys are you're digging in, you're figuring out what this means for your families, you're figuring what this means for your business, you're figuring out what this means for the kids, that you miss so much, and you're figuring out if you have a role to play in care for essential workers. And so what we saw was an outpouring of some unusual suspects who immediately said, what does childcare as a profession and industry need from us? And they delivered. Stowe Cider called us and said, it was their own idea. We want to put a portion of our proceeds to support childcare for essential employees right now. I had a call from Foley Distributing down in Rutland, who has been literally personally going in, sending their employees into their warehouse, tearing open their pallets, repackaging them in smaller amounts, and sending them out to those who are doing work for essential personnel. They literally called me to say, can you please tell the governor that Foley is a friend to childcare? Childcare has a friend down here in Rutland and Foley. These are things, that we've seen a little bit bubbling around, but we're just seeing every single day, everywhere we look. Congressman Welch asked us to be on a roundtable the other day and basically said, thank goodness Vermont has done so much work over the years thinking about childcare, explaining to the world the value of childcare and frankly, delivering it, what you all do every single day, really putting, a value on quality, really being there for your kids and families, supporting your business practices, improving your leadership skills. It's incredible. And I just want to say thank you so much. What you all have been doing over the past many weeks is incredibly complicated. Some things that you're grappling with are programs that usually take years to create and roll out, and you are doing them overnight, and you're grappling with sort of guidance that's been coming to you overnight. It's really a wonderful thing to behold. So my first main message is thank you. And the second thing I like to say from the next slide is we're having a moment right now. We're having a moment. And what does that mean? So quick pause. This is Bo and Wesley. These are my 17-month-old twins, and found a new fun activity where Wesley likes to ride Bo safely. They're both really enjoying it and laughing in this picture, so I thought it might be fun to share with you all. But I'm juggling this job and being at home with my kids and missing my childcare community greatly right now, but we're connected through continuity of learning, as so many of you are doing. So what does it mean to have our moment right now? The world is getting a front row seat finally to what you all have known for such a long time. You see right here, this is what we've started to say in the past couple of weeks, because it's just so before us. You are the heart of our society and the backbone of our economy. It is no longer an accessory, a nice to have. The world finally sees what you guys have known in your bones and seen through your experience, that we do not function without childcare. And kids and families absolutely need this. They need this. They need you, and they need your expertise. And so, the world changed overnight for us in some terrible, terrible ways, but in some really interesting ways too. We immediately at Let's Grow Kids were being asked to be on national webinars, being asked to, be on the radio, on the news, talking to our federal delegation. Because I think that everyone just said, what have we been doing? We cannot continue to ignore childcare. We have to respect it and treat it for what it is. So that's incredible. That's an incredible moment for us, and we all have to understand, what does that mean together? And I know how hard it has been for you all to go through this, to think about whether you're going to do emergency personnel care or not, whether you're going to close or not, whether you're going to be in the stabilization program or not. Your families are hurting financially. We're all hurting financially. And yet, the good news around all of that is that Vermont is still the first state and only state in the country that created a stabilization program to say we're going to have an industry when this is all over. It's not going to be perfect, it's not going to be easy, but we're going to have that. So we're emerging not only as a state leader because of all the work we have all done together over the last couple of years, but because of how we're choosing to react to this crisis. So that's a lot of opportunity ahead of us that we have to sort of jump on together. And what does that mean? The world is watching you right now, no pressure, but that's a really good thing. What does that mean as far as Vermont? We have already conditioned policymakers and lawmakers who then was pretty much a no-brainer to pass the stabilization program for them. I don't even think they thought about whether they should do it. It was just how they could do it. And so that's amazing. That means we've laid the groundwork to understand that we must have high quality affordable childcare in Vermont. And then we have to make it a cornerstone of our recovery. So we must all work together now to sort of step one, really continue to beat that drum and look at the stimulus funding and look at this federal funding and say, what is in there that we can put at one-time cost to move us forward to a valued and funded profession and industry. And one idea, for example, is IT. You all know, I'm seeing some chat about BFIS numbers right here on the right, so it's painfully clear, right? Our BFIS is a little bit outdated. You all have been the first to say that. Now imagine if we had a modern IT system, a one-stop shop for you all that you didn't need to refresh every 17 minutes. You never had to open up Internet Explorer again to do your attendance. That would be pretty incredible, modestly priced compared to other things, and a down payment in good faith that we're really going to move forward in a clear way here, putting childcare front and center of this recovery, and it's beyond sort of just that convenience factor. Imagine what it would be able to do to say, families pay no more than 10% of their income. A modern childcare IT system would allow that to happen on the backside of the policy. So that's just one example. Another one is wages. As you all know, we as kids had been promoting with you all an idea of wage stimulus because it is unacceptable that on average, an early educator makes half of what a kindergarten teacher makes, often without benefits. It's unacceptable. And so we've started discussing that aspect of this before the pandemic. And you know what? Now it's really in our faces. It is unacceptable that you all were called to duty and you stepped up in so many different ways, with those wages as sort of throughout the profession, and many without lack of, benefits. So, is it an opportunity for us to use this fund and this momentum to say, we need parity wages. We need to respect this profession, and people are going to be wondering what to do, dusting off from all of this. And perhaps if there were wage, stimulus programs that you actually might have competitive wages and draw people into this field when we know we're going to have so much, demand when this is all over. So I want to leave plenty of room for the panelists. I'm excited for the opportunity for Q&A, but I'll just leave it at that. A big, big thank you to you all. And, you all are truly a key part of a thriving Vermont. And if we miss this opportunity coming out of this recovery, we've missed an opportunity for our kids and our families and for Vermont to be a successful economy into the future. So the world is watching us, but I think we're ready. Knowing all of you, I know we're ready. Thank you so much to the rest of the panelists for being on as well, and looking forward to the conversation.
Great. Thank you so much, Aly, and good afternoon, everyone. First, let me say thank you so much for what you do. I just want to reiterate the passion that that Aly really just sort of put out there through our computers and through our phones. Really thank you for what you're doing now and what you've done prior to the pandemic in caring for and nurturing children as your chosen profession and practice. I truly am humbled by what you do. And as a former infant, toddler, preschool teacher, trainer, coach, and childcare center director, I so greatly appreciate what you do, and I'm so honored to speak with you today. Again, as it says on the screen, I'm Dr. Lynette Fraga. I am the Executive Director at Child Care Aware of America. And so for those of you who are not familiar with us, again, thank you for the invitation to present to you today and share a bit about our organization and the national landscape. Those of you who are not familiar with us, Child Care Aware of America is a national nonprofit organization that works with state, local, and local child care resource and referral agencies and other community partners to ensure that all families have access to quality, affordable child care. And we do that by providing training and technical assistance for professionals. And we also importantly advocate for child care policies that improve the lives of children and families. That's really the heartbeat of what we do as a national organization, because we know that it is going to take all of our collective efforts to mitigate the damage done to the childcare system during this emergency and to re-envision the childcare system so it comes back even stronger than before. I want to echo some of what Aly shared a little earlier about Vermont stepping up to the plate and frankly, heroically playing in and leading the nation, frankly, and at the forefront of doing this. And one of the states that has certainly done a terrific job, even as hard as it has been, keeping their eye and focus on childcare. So I am also honored to be on the board of Let's Grow Kids, and over the years have come to know Vermont and Vermonters, and I can say you truly inspire me. And the grit that it has taken through this pandemic certainly is something I think you all were well positioned for, given the great work you do in the state for children and families. The reality is nationally, childcare has become at the forefront of conversation, which is really great, similar to what is happening in Vermont, and so essential for many families to be able to return to work, as all of you know already. Family budgets are already being strained and stretched, as many have been without work or had a decrease in income because of the coronavirus pandemic. I'm sure you, like many of us across the country, are listening to the unemployment numbers that continue to be released weekly, and it's hard to hear. We need to ensure that all childcare providers are able to open as soon as it is safe to do so for those providers that have closed. And so families can get back to work as soon as they're able to as well. At the same time, childcare providers in the childcare system are facing numerous challenges. Next slide. Thank you. Oh, I got it. There you go. Go back one. Sorry. You were on the right one. CCAOA, or Childcare Aware of America, hears from providers daily about what they are facing. These perspectives are likely not unfamiliar to you or to your colleagues about what they are facing, and we are here to help and raise those voices. So I want to just reiterate again that you are not alone. There are childcare providers and colleagues across the country who really care about you and about what's happening to the childcare system. And so what do we need to do? That means advocating for support for childcare with policymakers and developing and providing relevant resources as we all try to navigate our way forward. Some of which Aly mentioned earlier about the resource page that Let's Grow Kids already has around COVID-19. We're working at Childcare Aware of America to secure support and funding from Congress so that childcare providers are able to make payroll and pay other expenses such as rent and utilities, provide increased pay for early childhood educators and staff who continue to offer services for children of frontline workers. As was said earlier by Aly, compensation was an issue before the pandemic, continues to be and will continue to be an issue until and unless we address it. So that and we also are looking at costs of childcare for essential workers. The CCR&R agencies across the country play a critical role in these systems across the United States. And importantly, for support for parents or caregivers experiencing an inability to make those co-payments or pay tuition, which so many families are grappling with right now. And even while we're contemplating the challenges of today, I think it's so important to raise up that we are also working to re-envision the childcare system so it comes back even stronger. All of the things we knew before, we're trying to amplify, and we're also trying to re-envision what's the art of the possible as we think about quality, as we think about compensation, as we think about benefits, as we think about parents being able to support and afford quality. So the coronavirus outbreak and its economic, health, and safety implications have revealed existing and new needs within the childcare system. The childcare system is already exclusive for too many, out of reach because of cost or geography. We see that across the United States. And early childhood educators are now being asked to do more and serve in riskier situations with the meager compensation and resources they have. With new public investment in childcare during this crisis, we can begin to support and grow a more equitable system for the future. As we re-envision this childcare system, we see so many needs. We have to address so many inequities. Despite low wages, early childhood educators, and across the country, primarily women and often women of color, provide an essential service to our communities, something we are seeing firsthand during this emergency. They deserve to be treated as the professionals they are and to be fairly compensated. In addition, the price of childcare is out of reach for too many families. We really believe that this is going to become even more true for even more families during an economic downturn. So now more than ever, we must invest in health and mental health resources for childcare. We need more health consultants, supplies, guidance, and training to dedicate to supporting childcare providers. This also includes strengthening, not weakening, our health and safety standards. We also want to invest in quality and infrastructure to bolster to weather the ups and downs. And the good news is that Congress has begun to acknowledge the essential role that childcare plays during this public health emergency. It's unfortunate it's taken this in order for it to happen, but we are seeing the $3.5 billion down payment, we consider it a down payment, and childcare funds to states in the last stimulus package, which is a beginning. And we hope these funds provide much needed help to the childcare system in the short term. We're already seeing that many states are using the funding to support the emergency care they are providing for essential workers. But at least $50 billion is needed to keep our nation's childcare infrastructure from crumbling in the long term. Without this assistance, we are very concerned that we may not have much of a childcare sector to come back to post-pandemic. So here's the thing. Childcare should be viewed as a core infrastructure in the United States and should be funded as such. Without childcare, a large portion of the workforce would be unable to work. We're seeing that happen now, and the economy would suffer as a result, and we are seeing that happen as well. Fortunately, earlier this month, Senators Elizabeth Warren and Tina Smith released a plan that includes many of these key principles for childcare relief: support for emergency essential workers, support for providers and educators, and an investment in the future of the system. And we're grateful for that. We're grateful for the amplification of the stories and challenges we're seeing and hearing in the community. Since then, a number of other senators and representatives joined the chorus, which is excellent, calling for meaningful, dedicated relief for the childcare industry. And as federal and state governments deliberate when and how to reopen the country, we have to and must address the needs of our parents, our children, and our childcare workforce as prerequisites to reigniting our economy. In order for us to reignite the economy, childcare has to be supported. Last week, Childcare Aware of America actually released a national survey with Save the Children that shows that 80% of voters supported targeted financial assistance for the childcare industry from the federal government to address the impact of COVID-19. This is overwhelming support. It crosses party lines, ideological persuasions, generations, and economic classes. That is good news because voters clearly understand that a strong childcare industry is essential to getting the American economy back up and running. And we are sending a clear signal to Congress that childcare must be prioritized. So let me say again clearly, you are not alone. There are so many others out there that are with you, that are you, and that believe in you and in childcare and are fighting the fight. Your voices and stories are so important right now, even more so given Senator Leahy is ranking member of the Appropriations Funding Committee. It is absolutely worth your time to reach out and request a meeting via conference call, sharing your stories and connecting the dots to the need for additional funding, and it would go a long way. We're actually at Childcare Aware of America advocating a great deal. On Monday, we're actually having a virtual symposium, and you can actually visit our website as well. There's on your screen some of Childcare Aware of America's resources, and I'll put some information in the chat about how you can also go to our Digital Action Center, which provides, again, a national voice. I know Let's Grow Kids and others are really amplifying the Vermont voice, both in Vermont and on the national scene, and we certainly are a partner in that. I just wanted to show briefly some of the things that Child Care Aware of America resources around COVID-19 is available. You can see it on our website for sure. I know that Let's Grow Kids also has theirs too. I would just ask that you take a visit, see if there's additional information that may be helpful for you. We created a child care search tool, some technology platforms, connections to other states. If you're interested in what's happening in other states, we have a state map that provides policy information as well as availability information for parents and providers, just so you can get a sense of what is happening across the country. An interactive map on the site shows essential workers by location, by zip code, and what that child care need may be. We also have a Share Your Story page, which we'd love for you to share your story. In conclusion, the impacts of this pandemic on the child care system will be felt for years to come. The impact can also be positive. We're working closely with child care resource and referral agencies and other national and state partners to ensure that the child care industry recovers, that federal and state policy efforts reflect the true needs of providers and families, and that the system is stronger, better, and supportive, and provides an equitable opportunity for each and every child across the country. Thank you so much again for inviting me to be on, and I look forward to hearing the rest of the webinar.
Morgan Crossman, and I'm the Executive Director of Building Bright Futures. I am also the mom of a 2.5-year-old who is testing every boundary you can imagine right now while I am working full-time from home, and I have a spouse who's navigating unemployment. So I also want to say thank you. I don't know how you do it. And, you know, I think that it's so important for us to all recognize the importance of social emotional development and continuity of education, and recognizing that as parents, we are sitting in this moment right alongside you, trying to determine how we do what's best for kids and families. It's also so critical for me to say to you all that as an early childhood community, this last month has proven to me exactly why I wanted to return to my home state to raise my daughter, because you all have stepped up in ways that show how much you value your kids, the families, and the communities during this time, and you're modeling the way for the rest of the country. I also think it's important to say that you all also are keeping children at the forefront of this conversation, right? Thinking about critical periods of development and the importance of education happening before the age of 5. And not just child development, but recognizing that we're also needing to keep on the forefront the health concerns of our kids and families and their well-being, and trying to determine what's best from a timing perspective. And our team at Building Bright Futures is doing the same. We are here right alongside you, reminding our decision makers at all times to keep children and families at the center of that decision making. And so for those of you who haven't been as involved in the work of Building Bright Futures, you know, our role in this moment and at all times is to serve as a neutral convener, which means bringing different partners together at the state level, at the regional level, and locally to say, what topics and areas do we need to be thinking about? What are the gaps and the needs and the concerns? And how do we strategize? Who are the people that need to be at those tables having those conversations? We're also monitoring the needs of the communities and then elevating those concerns and needs to our decision makers. So one of the ways that we've been doing that is through early childhood forums, specifically on childcare over the last month. And that is where we've really worked hard to provide direct connections with our agency partners to folks on the ground that are doing this work and allow that direct line of questioning and comments. Another thing I think that is important to highlight is that we as an early childhood community have a very complex system of services, and childcare is situated right in the middle. And I think that COVID has really elevated the critical nature of childcare. And then in thinking about the needs of our here are a couple of the themes and priorities that we're hearing right now. So not just childcare I'm recognizing that my internet connection is unstable. So someone flag for me if I'm cutting out a little bit, okay?
You're back.
Perfect. So recognizing that emergency childcare is something that had to happen right away. How do we stand up emergency and essential childcare for those essential workers, as well as supporting financially childcare programs during the closure period, and thinking critically about what does this mean for after school programs and how do they fit into this conversation? We're also hearing about food security and the need and basic needs of families, right? So access to food, diapers, wipes, formula, and recognizing that you are all on the front lines of identifying some of these concerns for families. And so how do we support them in this moment outside of the childcare arena? We're not surprisingly hearing quite a bit about family safety and mental health. So challenges with caregivers meeting their own needs, taking care of themselves, dealing with mounting economic pressures, risk for domestic violence and abuse, as well as substance abuse. And then thinking quite often about healthcare. And so not just typical healthcare and access to health insurance, but how do we now the health and well-being of folks who are serving children whose families are essential employees on the front lines of this pandemic? What do we need to be thinking about in terms of telehealth, concerns for pregnant and postpartum women, home visiting, and mental health supports? Another area that I think is so important to talk about, especially when we're thinking about childcare, is how are we supporting families of children with disabilities and special healthcare needs? Another key thing that is on the front of my mind is technology. And we heard a little bit about this in terms of the technological infrastructure that we need to be monitoring the system, but what about connectivity for families who don't have access to be thinking about distance learning? And how do we set appropriate expectations in this moment for that? We're also, not surprisingly, pivoting out of this emergency response mode and looking towards opening and recovery. So what are the clear guidance that we need? What are the expectations on the process for reopening Vermont and the safety measures? And I think it's important to note that as we're thinking about the gaps and needs, it's not bringing up entirely new issues, right? We're also seeing highlights from the existing challenges and gaps in our current system. So I want to take a moment to, from a childcare perspective, outline what Building Bright Futures is hearing as the evolving challenges over this pandemic. So there are 4 key to pay rent and utilities. There's continued confusion on invoicing, billing. How do we get paid? What does that process look like? There's been challenges with clarity about how different funding streams are collaborating to support families. For example, some of the pre-K dollars or the child care financial assistance program. And I'm very proud of the early childhood community for stepping up and elevating your voice to say, these are our challenges and concerns to our decision makers in this moment. We also hear family concerns about enrollment, about child health, about the need to be working and thinking about alternative models of care. And then a huge concern around the health, safety, and well-being of our teachers, our educators, our childcare providers, our families, and folks who are trying to understand how they meet the needs of families as well as the state while trying to stay healthy. And then another key challenge is clear, consistent guidance and communication. We at Building Bright Futures know that it is incredibly challenging to get the most up-to-date information, and we are working very closely with agency partners to make sure we're disseminating those things out. I also don't want to focus on the successes that we've seen in this period. So first and foremost, how quickly our state was able to pivot and respond to the needs of children and families in standing up emergency childcare for essential persons and designing a plan in a week's time, which again is not without its challenges, but to ensure stability of our childcare arena once this pandemic has subsided. I also want to highlight the fact that we have used existing partners, relationships, and infrastructure to think about what that system could look like through childcare referral systems, right? And really focusing on building relationships. one of the most important things that I have seen, that I have not seen before this time period, is the incredible partnerships across agencies, across the different sectors, and public-private partnerships and communication that have emerged in this moment. It has been so incredible to see the number of key strategizing meetings that are happening sometimes twice a week, just to make sure that we are all on the same page and aligning our initiatives. And then finally, our state has recognized the importance of childcare as essential, right? We know that you all are holding so much of the key to being able to support our kids and families in the state of Vermont. And so
I'm
the
afraid,
first,
oh, Morgan, you cut out there. It looks like you're back.
okay, thank you. I am getting an internet unstable message, so thank you for that. Am I back?
Yes, go ahead.
Perfect. So in thinking about the future, I think the key here is true cross-sector, cross-agency partnerships and collaboration, and really engaging the public in trying to understand the needs and the gaps and the challenges. So I have seen just in the last 24 hours, many of you reach out to say, this is what we're concerned about. These are our questions. And I want you to know we hear you, we are elevating those messages, and we are absolutely being as thoughtful as possible when we're providing information to decision makers. And I want to stress that point. We are doing the best we can in all of these moments. I think we're also going to see so much of a focus on health and safety. And we've seen partnerships through the Vermont Department of Health and partnering with the Director of Maternal and Child Health, Brina Holmes, to ensure that we have appropriate procedures moving forward. But again, keep elevating your concerns in this area, because we need your voice, what's happening on the ground. I think as we're thinking about reopening, there will be conversations around how we get families and children access to care, both childcare and pre-K. There will be discussions around additional resource needs for childcare, and additional conversations around the supply needs during reopening, given the health and safety guidelines. I think we're going to be very strongly considering what continuity of learning looks like in this moment for the early childhood arena. So when we think about 0 to 5 and pre-K, how do we support folks in this early childhood development period? What does this look like for children with disabilities and special health care needs? How do we now recognize even more than ever the importance of mental health and supporting not just our children and families, but our providers, our educators, as they are in this with us in transitioning? I heard Aly and Lynette talk about technology needs and where we need to be thinking about in terms of our infrastructure. And then the continued need for forums. And I hope that you all have found these forums that we've held helpful in having direct access to decision makers and being able to elevate your concerns and hear the most up-to-date guidance as it's coming out on a weekly basis. So thank you again for continually holding the child at the forefront of this conversation and being mindful that we're talking about health, we're talking about development, and really doing what's best.
Morgan cut out again, but I think that was her closing statement. So I'm going to turn it over to Lawrence to wrap up our panelist discussion.
Sure enough, and I'll be brief so that we can get into the questions. The vision of what could be after this crisis is so energizing. And I have had the pleasure of working with Aly for many years. When I was the Secretary of Commerce for Vermont, she was in the governor's office, and she was just as passionate about making sure that everybody understood that childcare is essential infrastructure for economic development. And that's true in every corner of the state. And as we've talked about on these calls before, this opportunity that can come from crisis is something that should not be wasted. That being said, getting from here to the opportunity to realize that vision is going to be a stepwise process. And it's gates, not dates. That is, we need to reach certain thresholds in Vermont so that we can reopen. One of those thresholds for general businesses reopening is going to be reestablishing the child care infrastructure overall before other businesses can be free to open broadly. So you all are going to be a priority. That being said, we do know that the antibody tests that are out there are not useful at this point. They don't have the level of efficacy that we need to be able to rely on them. And we don't even know if people who get COVID-19 generate enough antibodies from that experience to be immune thereafter. So there's a lot we don't know that's really fundamental to the science of how society broadly reopens. So right now we need to assume that social distancing, limits of 10 or fewer per location, and those kinds of things will probably happen and continue for a long time. That raises interesting questions about working very closely with kids who need physical touch, who need to see your face, who need to express themselves in different ways. And so I think there will continue to be enhanced sector-specific guidance coming out. And I've dropped a link into the chat for where you can go if you're not following the guidance for essential centers that are open. You can go there and look at what that current guidance looks like. And I think it's instructive for what you might face if you're closed. Right now, we've got an idea that the governor will begin to make an announcement about childcare with a change date effective maybe June 1st. But that's going to be dependent on this initial opening up process being successful and not having other outbreaks and not having other people spill into the state. This is going to be with us for a couple of years. That gives us time to mobilize, to take advantage of the understanding that people have, and really be prepared. And understanding the lessons learned from this phase will be incredibly important. And all of these organizations will be there to help translate your experience into strong advocacy for public policy at the local and national level. So hearing from you what's really happening to you is super important. And with that, I think I will turn it over to Brenda for Q&A.
Hi, everyone. Good to see you here. I've been trying to keep track of your questions as they come in, and I thank you panelists for addressing so many of the things that have been on all of our minds. And I want to just note before we start posing the questions, so Emily and I tag team the questions, and I just would like to note that some in the Q&A field, there were some comments as well as questions. And I also want to point out that some of the questions have been addressed on previous webinars. So we may, if we have time, we'll readdress them today. But I would point you to the questions that where we have answered those. And we'll remind you of where to find that at the end of this conversation. And also, I just want to recognize the dilemmas that some of you have raised in the question and answer format. So they just know they echo our concerns as well, as you heard the panelists speak, and as we, do our work sort of behind the scenes, as it were. And, some of your concerns are around your own safety as you return to work and as you serve families. And there are concerns expressed around liability and uncertainty about timelines and living into new health and safety guidelines and practices, and concerns about having the best information, the most current guidance. So we hear you, and as everyone said, we are collectively, and we know that many of you are as well individually, championing your cause, and because we believe that it is our cause. So Emily, do you want to lead with the first question?
Sure. So a question that gets at some of those issues. As states have begun to reopen, state government officials have been clear that any employee in businesses that are not comfortable returning to work will be considered to have voluntarily quit. Vermont child care providers have many people and organizations in their corner, thankfully. If our state reaches the stage where we're forced to reopen, however, it will be subject to the same expectation of returning to work or will it be subject to the same expectation of returning to work or voluntarily quitting? I'm a young toddler teacher in Shelburne with an almost 3-year-old and a second child due at the end of June. I feel nervous about sending the new baby to school or
Until Emily comes back, I'll finish that. I feel nervous about sending the new baby to school or exposing him by me and my daughter returning.
So there are exemptions to that notion of the voluntary quit effect, and I expect those will stay in place if you are a member of the vulnerable population or co-housed with a member of a vulnerable population, or you don't have a child in school. Those are currently exceptions that you are not required to accept a return to work. And I expect we will see those continue to evolve usefully as we go through this.
And might I just jump in, Brenda, and Emily, you're back. There's a resource that's about to start up and running. Many of you may have been familiar with our programs team doing webinars with Brina Holmes and others from the Department of Health. That's about to start up again in a big way, maybe as soon as next week. So I really do want to draw folks' attention to that, because that will be the best way to address a lot of the questions that are coming in, including touching upon what Lawrence just answered as well. You know, what is your own, like who actually is vulnerable? What are the new public health guidelines? How do you do this in a safe way? There's a lot of really good information out there. There's a lot of misinformation, I will note, that is spreading fast. And so I really would encourage folks to, you know, take a measured approach and be on those webinars and get that information right from the source. Because it looks like just in the past few days, there's some serious public health misinformation that's spinning around that we've seen.
Thank you, Lawrence and Aly. So I'm going to read one question, but it's also been reflected in other questions, so put a few together. Moving forward, when we open our doors again, how do we maintain safety for the staff and the children? There's no such thing as social distancing and 6 feet apart for our youngest learners. And some other folks in parallel questions talked about how, you know, wanting to see guidance that takes these kinds of things into consideration. And I think the language that was used was, have some guidance that's within reason, so that we can actually practice it and feel like we're doing well by the kids and the families, and we're doing well by the safety measures.
Yeah, I think this is going to be the focus of continuing guidance. Both the CDC and the Vermont Department of Health have continued to evolve. And I think it's really important to remember that the mask wearing guidance is very clear. No child under the age of 2 should, under the age of 3, excuse me, 2 or younger, should ever wear a mask. It's much too hazardous. So there will need to be tailored guidance for infant and toddler care in addition to the rest of the spectrum.
And there's so much go ahead, Lynette.
I was just going to say that I think this is one of those areas too, where though there are many conversations across the country, there's not necessarily consistent messages, which also makes it really hard for states to make decisions. We lean a lot on the Centers for Disease Control and their guidance, certainly want to sit within that guidance, but that's pretty broad guidance. And some of it, to Lawrence's point, mask wearing for children under the age of 3, for example. So I would recommend too, to continue, and I know we keep saying this, but amplification of your voice is so important. So that's how we put pressure on those that can provide guidance or create policies, supports, and funding, frankly, to do the kinds of things that are asked of childcare providers. So critically important to continue to raise it up. So the reality of both the expense and the infrastructure that's needed to actually operationalize any guidance that may come out is really critically important. So I would just put a pressure point there that your stories and what you're grappling with in terms of implementation is so important to put pressure on those that are in spaces and places that are providing guidance, or if they're not, that they need to. So I think that is also critically important.
And thank you for that, Lynette. That just prompts me to remind you, if you haven't yet opened the email that you got from the CDD last evening, they sent out a survey. I believe it's 46 questions, and they estimate that it'll take about 20 minutes. It is going to be 20 minutes well worth your time, because really what they're saying is, help us understand what you personally, your program needs in order to open your doors again and get back up to speed. What are you going to need? And they, from every angle pretty much. And one of my colleagues noted this morning, there's no word limit where you get to type in text. There's no word limit. So truly share your stories, your needs, and your concerns.
And Brenda, can I just add to that, into the general conversation here? The piece about the June 1st date that started to float around a little bit. The good news about that is, what that is trying to, I think, signal is that there will be a reopening. There are many complicated questions that you all are raising right now. And I think the whole idea of putting a date out there that is, over a month away, is to allow some time for the survey to go out, for you all to get your information, and for policymakers to really be considering all these complications so that we can make it as clean as possible. All I will say is the folks that are in charge of this are very aware of this complication, not just how do we do it safely, how do you all have the equipment that you need, the guidance that you need, but also the financial question. I've heard people state directly, from the state, we know we need to understand how this interacts with the stabilization program. It's certainly not going to be a, black and white, this is open, this is closed, right? There's going to be sort of this transitional piece. So all I will say is, there is understanding. It's going to be complicated for sure, but do raise your voices, and people are listening. So, and recently, I have heard some interesting, direct to some of these questions. The liability piece continues to come up. I've heard many times directly from the health department, there is no liability on a virus like this that's in the community. It's not being traced to anybody. It's never going to come back to you in your program. It's in the community, and that's something that's just out there. So that's a moot point. And the only sort of good news that I heard directly from a doctor connected to the NIH, who was sort of doing a quick survey of his findings for folks the other day, was that the only sort of bit of good news coming out of this is that young children really are not getting sick with this, and it's still unclear whether they are even vectors, whether they can even transport. That's still very unclear. But the very good news is that young children are not getting sick across the world since the beginning of this.
So as Aly is wont to do, she just answered the 2 questions that I had in the queue. So I'm going to move down a few. Thank you, Aly. Has there been any, Lawrence, this might be a good one for you. Has there been any insight into whether there's been an increase in COVID-19 cases as a result of children of essential workers being impaired? Anything about those trends?
I haven't heard of any such indication. I think it's important to remember that a lot of the cases in Vermont have been in congregate living facilities. The individual risk to people is fairly low. It's not something you should personally be that concerned about. 80% of people have mild or no symptoms. This really is about us holding back as a society to protect those few in the population who are extremely vulnerable because of how severe this is. And so the magnitude of the response is in respect of that, and in respect of a novel coronavirus being able to overwhelm the health system for even moderate treatment. So the fact that we are where we are in Vermont is a really good sign. We need to be persistent and consistent with these measures, but we need to be prudent, not fearful at the same time.
For a couple of questions about the governor's comments suggesting that childcare workers would be tested for COVID-19, and the questions primarily ask, is that going to be, who is it going to be? Is it going to be just the childcare staff, or is it going to be all of their family members? Sort of how would that be, how would that roll out? And I don't know if any of the panelists actually know the answer to that question. I'm curious if anybody has knowledge of that.
if anybody think about it while I buy you some time, there's one thing that's sort of related that I really wanted to say too, which is that, you know, there's going to be an opportunity, I think curated through Let's for Kids, for programs that have been closed to talk to programs that have been open, serving essential personnel. And we have so much to learn from those that have been operating over the last many weeks. We've actually worked out some of these questions with those who have been sort of having the on the ground experience. So I think that's going to be a really helpful opportunity for those that have continued questions to talk to their peers who have been doing this for the last couple weeks.
So I can speak to the testing, the pivot in testing in general, not specific to childcare, but generally we're about tripling the average testing rate that has been gone on as part of the test and contact trace. So it's not likely that you would get tested unless there was some reason from a contact tracing effort that indicated your center may have had some exposure through its family network, that you would likely be forced to undergo testing. Right now, the testing that's required is, for the RNA tests that are in Vermont, is what's called a nasopharyngeal swab, which goes all the way up and tickles your brain. It's not a pleasant process. It's not something anybody wants to repeat. What the state is trying to swing to is having availability of a nasal swab, which is more like just putting a Q-tip in your nose, not way up in your passages, or a saliva test. And that'll be something that could be a lot broader, that you wouldn't be torturing children with, that it would be more tolerable. And so when they talk about being able to have this capacity, this is about who is included in responses when the epidemiological team at the Department of Health believes there's a reason to test based on contact tracing or somebody developing symptoms. I hope that helps.
So I'm conscious of the fact that we got really close to the hour very quickly, and I'm going to turn it over to Trey in 1 second. I would just like to ask, there are a few questions asking about timing and whether or not the stabilization money is tied to the governor's reopen. Aly, do you have any sort of the best place for folks to be looking to get those answers, or anything that we know right now?
I think the best we know is the signals that we're getting. I do really think it's going to be around the June timeframe, probably between the beginning to middle of June. The real questions, though, are, is it a phased in approach or not? And just so you all know, we have some ideas on that because we're listening to you, that we're advocating for. And I think in the next week or two, we may have some draft plans that maybe, will be shared from the state. We don't know any of this, but this is just conjecture that since there's sort of a date that's a little out in the future, we may have a chance to participate in some of the draft planning and maybe see some unanticipated consequences, of some ideas that you all will have thought through that, others won't have, that we can, comment on. And, but, I think that's the best we have. And so keep listening to the governor's press conference. He's signaling, dates to that, and then CDD, and we will certainly jump on any information we have and get it out as fast as we can.
Thank you. So I do just want to remind everybody, we have a few other questions in the queue. We are going to use those to turn them into FAQs. If they seem very specific to you, we have your email through your question. We'll contact you directly. Trey.
Thanks, Emily. And first, thanks to Lawrence, to Lynette, Morgan, and of course, Aly, who I get to work with every day. But it's such a treat each week to work with our other consultants and friends. And so whether you were signing on from Calais, Vermont, or from the Burlington area, or Arlington, Virginia, as the case might be, we really, really appreciate you joining us today. And to our audience who've been with us for 5 weeks now, for 5 of these, we really love that this is meaningful to you and that this is a way to connect and help you think through some of the issues facing the childcare industry or your particular business. So we will be back in a couple of weeks. We're going to take next week off, as Emily said. We'd love to know what's on your mind and what would be most helpful. So as was said at the outset, please connect with us and let us know topics of, either to revisit or new topics we should approach. There are some reminders here about our consultancy and the ability to connect you with folks free of charge to answer your questions one-on-one. The State Employees Credit Union Emergency Loan Program. Our shared services work is something we want to remind you about. I don't want to belabor that because we're out of time, but if you want to talk to folks about shared services or learn more about the opportunity to work within a shared services platform, there's a link there. And then lastly, I just wanted to make sure you see that the Childcare Aware and Building Bright Futures web links are there at the bottom of the page. So if you want to learn more about Morgan's work or Lynette's work, you can click on that and do so. But we are at the hour, and so we're going to sign off and thank you all for being so wonderful at what you do and for carrying enough to join us here each week. Take care, everybody.